very warm and spirited welcome back, Nigeria. It's now time to have a very important conversation. The doctor-to-patient ratio in Nigeria is estimated at one doctor to between 3,500 to 3,900 patients. Now, this is a far cry from the recommended standard of the World Health Organization, which is one doctor to 600 people. Now, what this means is that Nigerian doctors and other healthcare workers are currently operating under intense pressure. And all of this is made worse by the migration of doctors, nurses, and other health professionals in search of better opportunities abroad. While Nigeria's healthcare sector continues to grapple with this growing shortage of skilled personnel, concerns about access to quality healthcare, the burden on the remaining workforce, and the long-term sustainability of healthcare delivery in Nigeria is now on the front burner. And joining us this morning to discuss the impact of medical brain drain and the practical steps that are needed to retain healthcare professionals and strengthen Nigeria's health workforce is the Chief Medical Director of Heritage Men's Clinic, Dr. Rashid Abbasi, who in secret I call our celebrity doctor because he's so popular and so informed. I see him everywhere. Good morning, Dr. Abbasi. Thank you for joining us on the table this morning. I believe it's 2 a.m. where you are, but you still made this sacrifice.
Thank you so much for having me.
Thank you, Dr. Abbasi. Dr. Abbasi, the other day we took a story here on the TVC Breakfast Show about Nigeria's first female neurosurgeon, Dr. Aliyu Ibrahim. She was the first to do it in, I believe, the year 2014, and she made history. And now she's apparently, relocated to Boston, where she's now going to be working there and applying her specialties there. And she's not the only story like that. There are several, trained professionals who can offer world-class services, standards, and, their knowledge to Nigeria. But unfortunately, they've had to leave. What do you think are the main factors contributing to this, unprecedented droves of doctors leaving our country? Because they're leaving their assets, and there are people who need their services, their knowledge, their expertise urgently.
Absolutely. And this is actually, if Nigeria is facing any problem, yes, I know we address the issue of insurgency. We're talking about poverty and all that. There is no more dire need that our government needs to focus on more than healthcare. Health is actually a form of wealth. It's actually the most prized of all forms of wealth that human beings are supposed to have. So unfortunately, we just lost another neurosurgeon to Boston. You know why? Talent goes wherever talent is appreciated. So far, there is no evidence that the Nigerian government or Nigerian people actually appreciates the talent we have in our healthcare workforce. Wherever you go, I'm in Washington, D.C., any major hospital, there is a Nigerian doctor there. So we need to start addressing the issue. Why are they leaving? They're not only leaving for money. Yes, money is important, but let's consider the welfare of the local Nigerian doctors. What are they going through? Our healthcare facilities are under-resourced. Have you been to any of our local general hospitals? They hardly have NEPA. There is no electricity. You mentioned at the beginning that there is one Nigerian doctor to about 4,000 patients. That's actually conservative. Our Minister of Health said Nigeria is left with about 50,000 doctors. For a country of about 220 million people, that gives you an estimate of about 4,500 patients to one doctor. So Nigerian government needs to show us that healthcare and the health and the welfare of its healthcare workers is a priority before we can even address why every single Nigerian, even the one in school, they're planning to Japa.
All right. I just, the last statement you made cracked me up, and I forgot I was going to ask you this question. Now, we have complained. We have seen the brain drain. What we would want to see as a solution is a brain gain. What are the things you think Nigeria as a people, as a government, should put in place that will convince medical practitioners that, yes, Nigeria is serious. We're on the way to improving our healthcare system?
Absolutely. Fantastic question, because it's high time we stop pointing fingers. Let's look at what are the solutions we can do. I'm a proponent of data. Look, if you're going to get a Nigerian diaspora doctor to come home, you need to convince him or her about the data. What are they coming home to do? What are they coming home to meet? So I'm in my private house here in Washington, D.C. None of my children have to go to a private school. So that is one of the incentives that is keeping me here, even though I keep coming back and forth to Lagos because, yes, I'm a Nigerian. But you have to look at what is going on back home, really. What are the working conditions for our healthcare workers? This is the major thing. A Nigerian healthcare doctor, either pharmacist or nurse, and is being sent to the war front, but their hands are tied. They don't even have adequate equipment. The other day, I received a message that Nigerian doctors, some of them in the north, have not been paid for months. So this is where the government needs to step in. And a major part for me is incentive. Look, every local street in Lagos, there are churches and mosques all over the place. Why? Because they are tax breaks. That is a major incentive. So if you want to start experiencing brain gain for diaspora doctors to come home or for the local doctors to actually stay home, we need to incentivize the medical practice. I opened a clinic in Ikeja. I have over 20 employees. Do I get any tax break to keep this floating? No. My local government chairman does not even know I exist. So it's not about pointing fingers. We need to look at how can we keep these people. The grass is not always greener on the other side. The grass can be greener at home. The things we can do easily, we can incentivize them. The other day, Nigerian Medical and Dental Association increased the fee on licensing for diaspora doctors. Give me a break. We need them. These are the type of people you should give license fee tax break for a few years as long as they can come back home. The fee is not a major one to them, but what about the local Nigerian doctors who cannot afford this fee? And we're still doubling the prices on them. So we need to really prioritize this if we want to show that healthcare is a major concern for us, because it's got to be a priority. The productivity of the Nigerian people depends on the healthcare of his workforce.
Well, I heard you, and I understand these issues you are trying to raise, which is about incentivizing Nigerians in diaspora to come home. And some will argue that the doctors are not the only one in diaspora. There are academics that have moved abroad, including professors, and it's not the first time. I remembered I was a university student when the foremost African literary critic, the late Professor Biodun Japa, I think he died earlier this year, moved to Harvard. So that migration, people who move from one place to the other is not something new. And when you take into account the issue of globalization, where capital is liberated, you can have your factory in Nigeria while you have the research and development in UK or China or somewhere else. So therefore, labor has to be liberated in that way, and that explains some of the movement. There are those who are moving in search of greener pasture, just out of the fact that, well, the country is not, they are paying people so much money abroad. If I change the money to Naira, I know how much it costs. Forgetting the fact that their cost will also be in dollars and pounds. And particularly, go and speak to doctors working in United Kingdom. They will tell you they're highly overworked. And some of them probably would take a different viewpoint if they had not migrated to UK. So that is one part of it. The second part of it is the issue of I know you decry the idea that we have a situation of 1 doctor to 4,000 patients. Of course, the World Health Organization did not actually recommend any ratio to anybody globally. It is the Nigerian Medical Association and the Ministry of Health in India that focused on 1 doctor to 600 to 1,000 patients. And that is a fact. Because the World Health Organization also recognized the role of alternative treatment, alternative care in every single country. So therefore, the recommendation is left to individual countries to be based on their local circumstances. So that leads me to my question. Where is the place of alternative, traditional treatment within this, your analysis and prescription on solution? You have people, when you talk about women midwifery, women delivering children and all that, they're playing very important role. If you talk about treatment of common illnesses, malaria and all that, they're playing very, very major role. So where do you place them within the healthcare system? Because the focus currently is only on trained medical professionals.
Thank you very much for that. But I need to address a couple of things you mentioned. So the issue of number of patients to doctor is actually not just only India. This is something we do aggressively in the US, because the more number, the more likelihood for mistakes. And so that's why we're particular about that. You know, I'm in a country where there's serious accountability when it comes to medical malpractice. You can easily get sued before you can say Jack Robinson. So emergency room set up because they want to look at what is the number of time. How many minutes does it take? When you show up to my emergency room or to my urgent care, how long does it take for you to be seen? Because I dare not leave you there when you're having chest pain or you're having stroke-like symptoms and you are the last person because my doctors are overworked. So we need to really face the issue of number of doctors to patient. I agree with you. There has to be more than one solution to this particular problem. This problem is humongous. So yes, there are roles for alternate primary care providers. If they're the local traditional herbalists, then Nigeria needs to structure them. You and I don't want to be in a situation where our fellow neighbors are drinking concussions that are not regulated and they do not even know what is in those concussions. Because you know what? They're going to end up at the emergency and accident place. That's our local general hospitals, where the doctors are already overstretched. Again, the issue about migration is more than one thing. Talent will go wherever talent is appreciated. The Nigerian government needs to now show appreciation for our own local talents. I can give you an example. Philippines exports over 30% of its citizens. Why? These are citizens because they know that there is need for global hospitalization, hospitality business. So what do? They incentivize their own Philippine citizens to take up these hospitality jobs abroad. It brings more tax and it brings more remuneration of foreign dollars into their country. Nigeria, we have multiple issues in terms of our medical healthcare workforce. We're not even producing enough doctors. On an average year, Nigeria produces only about 4,000 doctors. Granted, half of them are ready to Japa to get out of the country. So what is our government doing to try to keep them? And trust me, it's got to be about incentives, because the grass can be greener both here and the other side.
Absolutely. Dr. Abasi, you've spoken a lot about incentivizing, and it shows me that you do care about the welfare of Nigerian doctors. But I want to focus on something experts are calling the Japa tax debate, or essentially a talent poaching fee. The question is, should these Western nations who are absorbing our medical talent, our localized doctors at a subsidized rate, should they pay us a bonding fee, a talent poaching fee, and then we take that money and absorb it back into our system? There's also the issue of bonding professionals. You know, people are saying that the Nigerian government, I don't know if that's already happening or if there's any laws, but should the Nigerian government make doctors work locally for 5 years, before now deciding that they want to leave? What are your take on these two things?
Excellent question. So let me address the second part first. That look, should Nigerian government actually pass a law that prohibits Nigerian medical graduates?
Because we are in a national health security crisis, Dr. Abasi.
Absolutely, we are. But let's face reality. We're not just going to deal with this emotion-based. We have to face reality. You have sent your son or your daughter to school, yes, at a subsidized rate, because that's the government point. The government has basically subsidized medical education. And I can tell you how. I went to medical school here in America. Average medical student graduate loan for my class was $160,000 US. So you can imagine, nobody is going to force me to move to where I can get a better job to pay that. In Nigeria, the medical education is basically free. So Nigerian government can look at that as an angle, but I can just tell you it's not going to work. Because how are you going to implement this? You're going to seize all their medical certificates when there are other countries easing the conditions for them to come. And again, like your guest said, is global migration. The world is so global. So what we need to do, rather than come up with a punitive, because trying to force them from moving, it's a punitive idea. Let's compete on that level. And one of the ways we can compete is not only about their pay package. I live in a big house here. As an American doctor here, my interest rate for my mortgage is fixed. That is not happening in Nigeria. I came to Nigeria as a doctor, and the government is providing finance for people at a low rate, yet they're telling you that if you're 60, you cannot get the loan. Where in the world do you see doctors retiring at 60? These are little things that Nigerian government can step in, and yet we incentivize the other areas. If you want to see what is really going on, we need to go to the trenches. Go to Lasukom, go to Luth. You see Nigerian doctors, they're the one pushing the sketches for their patients. I don't do that in America. So we need to actually put a face to our people. And I made it a point before. I don't think Nigerian politicians go to the same hospital that our local Nigerians go. Because if they do, trust me, they will find solutions. They are not actually experiencing what local Nigerians are facing at any of our local hospitals.
Very interesting.
Now, if they do not use the medical facilities we have in Nigeria, at least they listen to television programs like this and radio and social media. The noise about it is really loud. Recently, somebody died in Abuja, I think Federal Medical Center in Abuja, and it was quite painful. Let us look at it from identifying the problem itself. The root cause, who is responsible for these things. Are you going to push your blame on the Federal Ministry of Health, or you are also going to say even the practitioners have questions to answer?
Absolutely. See, I'm in a country where every 2 years I have to renew my medical license. And every 2 years I have to go through an independent evaluation to make sure that how many patients have I operated on, what are my failure risks, what are my infection rates, what are the things I drop, my near misses. And they compare me to my peers. So I live in Maryland. We have 42 critical care hospitals. I'm not the only cardiovascular men's health person. So they compare me to my peers, and the more I drop the ball, the first thing that goes up is my medical malpractice insurance fee. The next thing, hospitals will withdraw my privileges. That is my ability to walk into an hospital and be able to see a patient. So guess what? I am being faced on multiple levels to keep up with my continuous medical education studies. Nigeria, we don't have that. We need to change that. That is something that the government can step in with carrot and stick. Every 2 years when I go for my license, I have to produce about 55 credits of latest medical stuff. So they keep you on your toes. So yes, there are failures and there are mistakes with our people, but we also need to remove the things that are making them make those mistakes. If you make me see over 4,000 patients, I'm human. I'm going to drop the ball somewhere. Doctors are human. So we need to reduce those things. At the same time, come around and let them know there will be accountability. There are places where you go, doctors will refer patients and there is no follow-up. That should not happen. Again, we need to look at how the system is failing them. We do not even have a national emergency medical record system in Nigeria. If I'm seeing you on the island and you are now on the mainland, how can I talk to the doctor without violating your privacy? Where are your medical records going? These are things that have been proven to reduce mistakes. So the government can step in. It's all about the government letting us know that healthcare and the practice of healthcare, as well as the workforce, it's a priority. If it's a priority, things will change.
Yeah, on a positive note, I don't know whether you will agree with me, because you guys are playing very important role in our lives also. We keep complaining that about brain drain, but we also have the brain gain. You can imagine the impact of new technology, which we have not even equipped our hospitals. You are able to, come into the country, help train others in how to use those equipments. And some of you are establishing clinics here with modern equipment. You are actually investing in our economy, some in real estate, someone like you in medical practice and all that. So for me, that's fantastic. I know in the psychiatric sector that very many doctors who have helped to introduce new practices, and they've impacted on hospitals like the neuropsychiatric hospitals, Japa and Abeokuta. At least I know of those two positively. Now, the other issue around that is the issue of diaspora investment in our country. And the doctors are playing major roles. I mean, if you look at the government target on the economy, on one part, we are hoping to raise up to $12 to $15 billion annually from diaspora investment. Will this not create a kind of contradiction if we keep saying that we should incentivize the doctors who are abroad to come home, when in reality we are actually gaining from knowledge, knowledge, information sharing, expertise sharing, advanced medical care, and we are also gaining economically from diaspora remittances? Will that not be a kind of contradiction? Shouldn't we be looking at a situation where the labor market is allowed to operate as it is currently, while the emphasis should be on producing more doctors, at the same time equipping hospitals adequately?
Fantastic. That's a good observation. But two things can be true at the same time. We can continue that because we're not doing enough in that angle. Remember, Nigeria is a country upward of 220 million. Our Minister of Health said we're down to 50,000 doctors. That is a drop in the bucket. Not all those 50,000 doctors are licensed to practice. Some of them are doing research. Some of them are in academics. So we're actually low. We're below the numbers. I agree with you. I believe in free market enterprise. I don't think the federal government should be the only loan provider for healthcare. That is why my issue about incentivizing. And in a country like America, we produce 17,000 doctors annually. Guess what? Our healthcare system says we need 24,000 doctors. Why do you think US is recruiting foreign doctors? Despite the fact that they allow free market to play, because the government is monitoring. We're not investing on data. We do not even know. I can tell you for a fact that there are some states in Nigeria where there are no specialist neurosurgeons. So if the free market is going to play, the government needs to come in and incentivize them. I opened a clinic recently in DC here. Guess what? My cheapest equipment is about $20,000. I wanted to write a check. The government said, no, we're going to list it on your behalf as long as you maintain a license in this local government for 3 years. And this is your rate. My brother, I'm not going to leave that kind of environment. So there are many, many things that we can do to help. So yes, two things can be true at the same time, but Nigeria is in dire need. Health is a form of wealth and is one of the most prized wealth. We need to pay attention to it.
Absolutely. Dr. Bassi, now when we use the term brain drain, it makes the situation sound mild. And I'm doing my research here and I just want to give out a very, very short list of the people who have left and what they could have done for Nigeria's healthcare sector. Aside from Dr. Salamat Aliyu Ibrahim, who was the first West African neurosurgeon, we have Dr. Oluyinka Olutoye, who was a world-renowned pediatric surgeon who moved to the US. We have Dr. Olufemi Ayeni, a prominent orthopedic surgeon who moved to Canada. Prof. Onyema Ogbuagu, a Yale infectious disease specialist who played a critical role in developing later on in his life the Pfizer COVID-19 vaccine. We have Dr. Timile Elusheyi. The list is endless. My question now is that if all these senior consultants are leaving, what now happens to the Nigerian healthcare system that might now be being run by less experienced doctors or overworked interns?
Absolutely. Let me take you a step back. In the 80s, it was the Nigerian medical academicians from University of Ibadan, UCH, from Ife, from Lagos, from Nsukka, that went to Saudi Arabia to create the Saudi Arabian healthcare system that we have today in Saudi Arabia. And guess what? The Nigerian government dropped the ball. We never filled that vacuum. So our academicians, not even clinicians, these were the people training the great doctors you mentioned. They left in droves. What did Saudi Arabia give them? Tax-free incentives. Saudi Arabia is an Islamic nation, no taxes. So all our doctors went in droves, and our Nigerian government, we were caught blind. We did not fill that vacuum. That vacuum, the chicken has come home to roost. That is what we're paying the price now. Our academic institutions, as great as Nigerian medical students are when they get abroad, we are losing them at a faster rate. So yes, all these great doctors have gone out. There are ways, but we need to actually have a sit-down table. It has to be a multidisciplinary approach to look at these things, because we are at the point now. I know people have been saying it, but we are at the dire need that we need to really address this. It's going to get to a point where it's already happening. You go to emergency rooms now in Nigeria, doctors will not see you for days. And then we hear about death on social media. it will be too late for us to cry at that time.
Absolutely.
We need to start addressing this thing.
Dr. Rashid Abbasi, thank you so much for your time this morning. Sir, I have to say, you need your own show. You need your own show. We don't watch. I'm tired of seeing you on this station, that show. Dr. Rashid Abbasi is the director of Heritage Men's Clinic. Thank you so much for your time. Have a great weekend.
Thank you.
Absolutely. Coming up, what does President Trump's commendation of President Tinubu's counter-terrorism efforts mean for our country, Nigeria? We examine the implications for security, international cooperation, and the country's fight against terrorism. Very warm welcome back, Nigeria. Thank you for staying with us all the way to this point on the TVC Breakfast Show. It's now time to link up with Tijesu Adeoye in our Abuja studio for the FCT brief. Tijesu, what's a brief from the FCT this Friday morning?
Thank you, Olamide.